Hey guys, it's Courtney from the Ivy League here. Today I'm going to talk to you guys about clinical requirements for going to the hospitals, what you have to do, that kind of stuff. So the very first thing that we had to do was we had to get CPR certified if we weren't certified already. I've worked in a hospital for quite a while, so I keep mine up to date. It's every 2 years, and it's a complete, you have to do the complete class, you can't recert. So that was kind of different. So I had to completely take the whole class. We also had to do TB skin tests, which you also have to do to work in a hospital. But the difference is that we had to do a 2-step skin test. So one was we had to get one by a certain date, have that read by a certain date, then get a second one done by a certain date, and then have that one read before they turned the paperwork into the hospitals that we were going to. The third thing that we had to do is we had to prove that we had immunizations done, and if we could not prove that we had them done, then we had to get them done over again. So I had basically some of my paperwork from my pediatrician's office is actually where I had to get it from, and the only reason that they kept it so long is because I have our youngest sibling, my little brother, just turned old enough for them to keep his records. Like he was on that cusp of like they were going to get rid of his records and start filing them away, but so I fell like right in that area, so I really didn't have a problem getting them. The only thing that they couldn't prove was that I had chickenpox ever, which ironically enough I had for the second time 2 years ago. So that was easy enough to prove. I really just had to get the lab printouts where they were watching my titers go down. I actually got it probably from somebody at work. Somebody either brought a kid in that had it, or was taking care of a child at home and came in, which is super, super dangerous to do. Hopefully they didn't know. I don't know. But so that's probably where I got it from, because that was the only place that I had been around that time period. It was awful. Having it as an adult sucks bad, but having it around a child can be deadly, around an infant, which I work in labor and delivery, so they have they have the, some antibodies from mom, but not a lot, so it's really, really dangerous. And so that was easy enough to prove. I just printed those out and gave those to them, and had the doctor that ordered them sign off on them. I was actually in the hospital, so it was really easy to get all that information. So before we can go to the hospital, we have to have checkoffs done. So you'll have checkoffs. We do those, we call it lab. And basically what we do is we go into the lab and we perform certain tasks in certain orders. It's basically, if you've ever taken a CNA class, it's very similar. You have a list of things that you have to do. Certain things are automatic failures if you miss them. So it's pretty much exactly the same, only it's nursing related things. This week the checkoffs that we're doing, I think I told you guys before, we're starting IVs, primary lines, and piggybacks, secondary, and then suctioning trachs and whatnot. So I have those on video. I was actually watching them just a little bit ago, and I'm taking a little break now. So you have to do those things before you can actually touch anyone to do those in the actual hospital setting. So we also had some paperwork to fill out in class about computer programs. You get a login, and even if you work for that facility, you will get a second login as a nursing student, because the two should never mix. You should never use your work thing to chart, your work log on to chart on your clinical patient, or your clinical log on to chart on someone that you're taking care of during your normal shift if you're a CNA or what have you. And so we sign up to get those. Obviously we sign confidentiality agreements. And that's basically, I think we got to rank our choices for clinical. Some people got their first choice. They didn't. I'm in my first choice during the second session, so I'm really excited about it. And but I'm glad that I went where I went for my first session, because I would not have seen and learned what I did otherwise. It was a level 1 trauma center, so it was a really, really good place to get started, I feel like. And actually, though it wasn't my first choice, it was my second choice, I feel like it was the better choice. It just worked out better. And also because I had who I had for that clinical. The instructor was very strict on care plans and charting, and I don't know, it worked out for the best. I got 100 for my charting in clinical, which is crazy. She said that I charted the best of anyone in the class, which is probably why people were asking me if I could help them with that, I guess. But so that's really all we had to do for that. Those and the checkoffs, and are really all that were required by our school. Now, your mileage may vary. Every school is different. Every facility is different. So you may end up having to do different things. You know, if you're at like a government hospital, a government-run hospital, say like a VA or something like that, you know, or a government clinic or whatnot, your mileage may vary with that, because, you know, because it's a government-related facility. You may have to do different things, get fingerprinted, what have you. So just keep that in the back of your mind, that might be something that they ask you to do. And certainly none of the information that we filled out made us feel uncomfortable. It was all very appropriate, and, you know, we're just really excited to get into the hospital. And so like I said, this week we're doing IVs and stuff like that. During the middle of the session, we have our HESI, and that same day we're doing IV push medications. So we will be allowed to give these medications with the instructor present, which is really exciting. We already learned IM and sub-Q injections, but we haven't learned, you know, starting IVs, priming, tubing, and stuff like that. And those are the videos that I was just watching today. So I really like that our school has some of the videos, so you can kind of familiarize yourself with the practices before you go into practice. It really helps you feel confident that you've got down what you need to know. Or, you know, if you have any questions, you can just refer back to the video, watch it, be like, oh, okay, well, that's what she did. So then, you know, you can try again. So we're doing the practice today, and then we don't have checkoffs anymore because they've already watched us check off on medication administration. And since IV fluids, piggybacks are all medications, we're just basically being watched on how we prime the tubing, you know, make sure we scrub the hub, using, you know, good hand hygiene, stuff like that. So that's basically it. So if you guys have any questions, leave them down below, and make sure you click like and subscribe. Thanks, guys. Bye.